Matthew Holt, another THCB Spotlight from the show floor at HLTH, the oddly named conference. There with Pascal Zuta. He is the CEO of Gyant, which is in the business of, well, you'll tell me this, mostly in the business of, at the moment, a sort of chat-bot, front door, symptom checker, plus. So tell us a bit more about what Gyant does. Close enough?
Well,
on the way.
Yeah, on the way.
Tell me more.
Let me. Yes. So how I would talk about it is what we're building is a digital front door for hospitals, health systems that helps patients find the right care. So you can think about it like a chat-based assistant on a hospital's website that understands thousands of intents. So you can come and say, I've been coughing for the last 2 days, and I don't know what to do, and then we'll find you the right care, and we can even write your history into the health record. Or you can come and say, I don't know where to park my car, and we'll have an answer to that as well.
All right. And then stylistically, because I've seen a demo, we don't have one here, but it's got some interesting features. So just give us a flavor about what it looks like if you as a user comes to this, which maybe a bit different to some of the others in the market.
Yeah. So we have a background that comes a little bit more from the consumer industry, from the video games industry, and we believe that healthcare software should not smell like a hospital.
Right.
And that's why we've built Gyant to be an experience that is a little bit lighter. There's some fun in there. There's also some empathy. So there's one element where you see emojis, for example, which is easy, but it's just a different choice of style. But there's another element of it where this becomes technology, and where we've built actually what we call algorithmic empathy. So if you talk to Gyant and you talk about that you have a high fever, Gyant would come back and say, I'm sorry to hear that. So there's some kinds of empathy that we're building into our technology as well.
Cool. All right, so you mentioned that it's there for the front of a health system and a hospital. Tell me a bit about your company development and where you are in that whole process of rolling it out, sales and all that kind of stuff. Let's start with where the company came from first.
Yeah, so the company came from a B2C place. We thought that we can crack this from the B2C side, and we relatively quickly realized that this is really hard. We became part of the Cedars-Sinai Accelerator in 2017, and that was our first touch point with the world of health systems. And we realized there that they can use some help to help patients be less lonely. That's how I thought about it. And so then we realized, we developed this vision of building an assistant that can follow the patient all along their patient journey, from the situation of triage to potentially preparing them for a procedure and post-discharge. And one of the elements in there, as I said before, is that's important for us, is doing that in an empathetic way, and also doing it in a way where AI and humans blend together. So we believe that there's a future where AI and humans work together seamlessly, and where the AI does things that the physician does not have to do, so that the physician can focus on those things that only a physician can do.
And now you came out of the Cedars Accelerator. Did you end up doing a pilot with them? What's the rollout into the sort of...
We were far too early to do that with them. We're still in touch with them, but we're working with the Cleveland Clinic now.
Yep.
We're working with Providence and a couple of other big health systems. That's the focus area that we've put ourselves.
Where are you in the process? Are you in the development stage, or are you actually rolling out?
No. It's live. It's live and commercial with some of the larger health systems in this country.
Fantastic. Tell me a little bit about your background. You sound like a dubious immigrant to America like me. So
yeah. So German, obviously. I've started companies all my life. My first company was actually a film production company. I was a nominee in Cannes. So I started out as more of an artist. I had a social network. I started at that time largest doctor appointment booking website in Germany. Had a video games company that, together with my co-founder of Gyant, we scaled to 400 people and sold it to a large media network. Then we had then we built a cosmetics brand that still is the fastest growing cosmetics brand in Europe. And then we went on to
and healthcare, because in the end, everyone refugee gets to healthcare.
Yeah, we just wanted to find an industry where it's harder to make money. Yeah. But also we wanted to find an industry where it's easier to make an impact on the people's lives. So
you rescue yourself maybe at the end.
Thank you.
All right. Last question. So as we know, software and technology is all free. Have you raised outside money? Has this been your money so far? How much you put into this, and what's the state of play?
My co-founder and I would put in a significant amount, but we also have outside investors from all around the world, from Germany, from Switzerland, from Japan, from the US.
What's a significant amount?
I think we raised over 8 million so far.
Okay, so it's a decent chunk gone in. And
Decent chunk for a seed round, and we're raising our seed round.
I like the way that seed round is 8 million, the Series A is now 90 million or something.
Well, we'll see.
You're actively raising now?
We're raising now. We're raising our Series A. We're starting to raise it.
Okay, so that's the next step, and then I assume the idea is more of the same with more hospitals, more clinics. And is that the target area, or are you going to think about other? You're going to be thinking about other players.
Right now, we're really focused on the health systems, and there's a lot of them. So we believe that we found product market fit in this area, and we know exactly how to sell. It's repeatable, and the sales cycles are shortening, so that's very important for us.
That's amazing to hear about health systems. That's
yes,
great.
yes. We actually had a customer recently that went from the first pitch to the green light on the contract in under 4 months, which is totally crazy, I think. But obviously in the future, there's also a future where Gyant will work with payers.
And what about other languages? Is that's just English?
No, we're actually in 6 languages.
Oh, already? Yes. Are you in other countries already, or just?
Yes, we are in other countries already. We have a couple of customers that have asked us to go to other countries with them. So we're available in Russian, we're in Portuguese, in Spanish, in French, in English, in German.
German too?
Yes.
There's still people speaking German. Who knew?
Yes.
Who knew? All right. With all that Brexit stuff going on, I'm not sure now.
Well, right. English is in there.
American and English are the two different ones. All right. Fantastic. Okay. Well, that's interesting. Catching up on Gyant. I've been talking with Pascal Zuta, who's the CEO. Pascal, thanks for the time.
Thank you.